I'm Jonathan. I'm here seeing Dr. Lebowitz. I discovered him through a YouTube video, and I'm here and kind of excited to get my chest fixed, as well as Vaser liposuction. I'm excited and pumped to be here. Can't wait to see the result.
Let's do it. So these are my markings. I got the midline here and the pectoralis major muscle here. This is where we want to make a happy chest out of a sad chest. Ground zero is here. Ground zero is here, and the current breast tissue ends about here. So it's important when you mark this to mark it with the arms adducted or together. That gives you that perfect shape of it. You want to keep the muscle here, so you don't want a liposuction way up here. And right here, this is where you kind of don't want a liposuction way up here, higher than this little mark here. Because that's where you want to keep this triangle higher, kind of. You want to keep that. You don't want a liposuction. And actually, I have guys who actually want me to do some fat grafting there, but we usually don't as much as like people in like LA or South America or something of that nature. We do want a little bit of a triangle here. We want to liposuction this area here, a little triangle here. And a very important thing is this kind of this little triangle in the middle here. You want to liposuction that area. Now make a little crunch here. Good. So this is the top of his the first rectus abdominal muscle inscription. We want to do that. And also we want to, the latissimus dorsi muscle here, we want to sculpt that nicely too, and what's called the serratus anterior. Let's try this one over here too. Make a muscle where that, good, perfect. We want to sculpt here. It's all about negative and positive spaces. We want a negative space here. We want a negative space here. We want a negative space here and a negative space here. But we want positive spaces up on top. With my new stealth incisions, I'm going to do a little incision here and one right here where it's nice and hidden, right about there. So a little incision there. You bring it down, see where that is, and right there, and a little stealth incision right there. So here we go. This is where we want to sculpt out more. Here, here, so we have a negative space here, negative space here. We want to keep the volume up on top. A little negative space here, that gives you a good shape of that muscle, and really do fine tuning of the muscle, the lateral and the inferior border of the pectoralis muscle here, the lateral and the inferior border, as well as the latissimus dorsi muscle here. This is going to be done all under local anesthesia with extraordinary results. If you have gynecomastia, please call me, Dr. Lebowitz, at the Long Island Gynecomastia Center, Long Island VaserLipo Center. My phone number is 631-424-0101. That's 631-424-0101. See you in the operating room in a minute. This is Dr. Jonathan Lebowitz, Lebowitz Plastic Surgery, the Long Island Gynecomastia Center, the Long Island VaserLipo Center. So now we're in the operating room. I've already numbed him up. He's all numbed, both sides. He's comfortable. He's awake. And these little ports are here to protect the skin. I want to show you of importance my new stealth incisions. I used to make them over here, but now I'm making it right at the edge of the areola and up in the armpit here, and they're very well hidden. As a matter of fact, this little incision here that this little protector is, I will use that. Yeah, you can put that. I'll use that to actually make a little incision to pull out the gland. So I'm using the 5-ring, 100%. That's the Vaser. That's the foot pedals, and you're going to hear it as we go. And we're going to start to melt this fat with the Vaser and the gland.
That's ultrasonic sound.
So,
Here, so they don't fade.
so about 15 minutes, I think, Cookie.
Okay.
Between 10 and 15 minutes.
Okay, I'll leave them out.
So it's important to go up to the armpit. So this is ground zero that we're doing. And if you feel anything, just tell me. We can give you more local easily. It's very loud, I know. That'll become background noise in a few minutes, actually. This little triangle right here, get the edge. So this is the negative space right here, this triangle between the lats back here and the edge of the pectoralis muscle.
And 15.
Good. Alrighty. You alright? Let's get rid of this little thing here. Good. Okay, so let's do this side.
Okay.
All right, now we're going to switch gears, Cookie.
Alrighty.
Lipo. Alrighty. These new stealth incisions. Now, very nice. And this is my new stealth incisions now. So this is my Power X tool, and this is a power liposuction instrument to contour high definition. High definition. So I'm making negative spaces. The space between the lats back here and the lateral border of the rectus muscle, which is about right here. Up into the armpit. Get that armpit fat out of there. You all right?
Yep.
Remember this little triangle between the medial inferior border of the pec and the superior border of the rectus. This little triangle, we want to sculpt that out. That's it. Right in here. Just a little bit here. This little triangle up here.
You said that's a negative space or positive?
Negative space right here. Whenever I'm sucking, I want a negative. If you look at bodybuilders, they'll get this little
Yeah,
defect indent below the pectoralis muscle. All right, that's done. With this new technique, it's gonna just come out. So now we're removing the glands.
I'll be right with you. Oh, that's good.
You all right?
Yeah, no, it's fine. It's just interesting to see it come out.
That's it. It came out nicely.
Surprised. I thought it was going to be big.
What's that?
I was expecting it to be a lot bigger.
Not after the Vaser. That's the beauty of the Vaser.
So the glands have a lot of fat as well?
It's got fat, and also the Vaser just bombards it. Just melts this sucker.
You're gonna be really happy.
Yeah, and it's minimal. No more incisions. This is Dr. Jonathan Lebowitz at the Long Island Gynecomastia Center, the Long Island VaserLipo Center, just completing a case of high definition, 4-dimensional gynecomastia male breast reduction surgery. Of importance to this video is my new stealth incisions. I make one right here, one in the armpit, one in the armpit, These I close. These I put a little drain in, which I'll take out in 48 hours. This inverts my old technique where I made a little incision here, a little incision here, as well as here and here. They're stealth incisions. They disappear, and the results are extraordinary. I hope that people can appreciate the negative contour here and the positive contour here. He's swollen because I did use almost 3 liters or 3 liters of fluid. They're all self-absorbing stitches. These drains come out in 48 hours from now, and the results are going to be extraordinary. If you're interested in gynecomastia surgery, please call me, Dr. Lebowitz, at the Long Island Gynecomastia Center, the Long Island VaserLipo Center, 631-424-0101, 631-424-0101. We're located in Long Island, New York. Thank you for watching this video, and hope to see you soon.